Sometimes, albeit rarely, these symptoms can be time critical and also life threatening, so it's so important to get this checked out. Hi guys, I want to tell you a story of a chap called Jack. He's your average lad, 30-something years old, works in marketing, supports Liverpool, don't ask me why, but he's been getting this discomfort in his chest, a kind of burning sensation. He's also been getting some bloating after he's had some food and a sour taste in the back of his throat. He smokes 10 cigarettes a day, he drinks 2 bottles of wine a week and doesn't really get to do much due to lockdowns and things like that. What has Jack got? Today we'll be talking about acid reflux or heartburn. We'll look at some of the causes and why it happens. We'll also look at the symptoms to look out for. And importantly, at the end, we'll look at what Jack can do at home. I think his name was Jack. It's a totally made up scenario, so let's just say it's Jack. What Jack can do at home to get his acid reflux under control. Anatomy time. What is the journey of this piece of apple that I'm just gonna bite off now? Where does it go? How does it get to my stomach? That's a tasty apple. I then chew the apple up and swallow it so it goes down to my throat and into my esophagus, which is the food pipe that takes the food into your stomach. As it goes down to the esophagus, in the lower part there is a muscle called the lower esophageal sphincter. It basically acts like a gatekeeper into the stomach, opening up to allow things in, closing up to stop anything else from coming out. And the key with acid reflux is this lower esophageal sphincter. The best way to kind of demonstrate this is actually physically to demonstrate it with, bear with me.
3 hours later.
And like so, we have this beautiful thing. I'll let you take it in. This feat of engineering is going to explain to you the relationship between the stomach and the lower esophageal sphincter. We have the esophagus, we have the lower esophageal sphincter, and we have the stomach. What happens is, as food and liquid goes in through the lower esophageal sphincter and into the stomach, nothing should go back out the other way. So it's a one-way system. What happens in acid reflux is actually this sphincter becomes a little bit loose and there's a bit of malfunction with the sphincter, and eventually acid begins to go the other way. That took me 20 minutes to make. I'm not sure that demonstration really was that great. Do you want to see it again? Pretty impressive, huh? Blue Peter, eat your heart out, because that was a sick demonstration. Not all people will get that. British show from the 90s. 90s kids will know. We've explained acid reflux, and there's a few more words that are floating around that I want to explain. So if I pick out heartburn, basically heartburn is the sensation that you feel, the symptom that a patient describes when they get the acid reflux. It will be a burning pain because that acid is actually causing the pain receptors in the esophagus, the food pipe, to trigger off pain signals. So heartburn is that pain feeling that you're getting. It's got nothing to do with your heart. It's a complete different system. It's part of your GI, gastrointestinal system, whereas your heart is part of your cardiovascular system. Not quite sure who came up with that name, but just completely confuses people. The second one is something called GERD or GORD if you're from the UK. It stands for Gastroesophageal Reflux Disease. This is when acid reflux is happening regularly, either on a daily basis or every few days. It does pose some health risks further down the line, which I'll cover in another video. But importantly, if it's happening regularly, then the person has GERD. In terms of the symptoms, we talked about heartburn, and sometimes that burning feeling can start from the soft part of the stomach, go up to the center of the chest and through to the throat. It's important though with any kind of chest pain that we are very, very careful, and it needs full assessment by a healthcare professional, especially if they've got severe chest pain, if it's tightness, if it's crushing in nature, if there's clamminess, if the patient's very sweaty, if they're vomiting, if they're short of breath, if they've got palpitation or they're dizzy. All of these kind of symptoms can all signify something worrying. So it is important not to just kind of think, it's a bit burny, it'll probably be acid reflux. It will need a professional to assess it. If we look at Jack's case, he had a few of the common symptoms of acid reflux. So he had the bloatedness. Did we say he had bloating? I think I did. He had some bloating. He also had that odd taste, that kind of bitter or sour taste in the throat. People can also get a bit of nausea with the acid reflux as well. A few of the less common symptoms can be things like an irritating cough, a sore throat, a hoarseness of the voice. Again, these are all things caused by the acid irritating the throat, the vocal cords, but also some bad breath can also signify acid reflux. We're going to talk about now some risk factors for acid reflux and things that can make acid reflux worse. If we recall at the beginning, we talked about the sphincter at the bottom of the esophagus not working properly or relaxing sometimes, and that allows acid to leak through. But also at the same time, if there's a lot of pressure on the stomach, the content is going to be pressed up against this sphincter, and that itself can also cause some leakage through there. With that in mind, obesity, pregnancy, wearing tight-fitted clothing or a tight belt can all cause acid reflux to come on. So diet itself is a big risk factor. So if you're eating things like tomatoes, if you're having coffee, fizzy drinks, drinking too much alcohol, fatty foods and spicy foods, all of these are risk factors for acid reflux. Incidentally, my wife, who's from Argentina, they don't have any spicy food there apparently, and she tried Indian food for the first time here in the UK. Within like 30 minutes she was like, I'm getting this burning pain in my chest, and I was like, the beauty of Indian food. She loves it now, but spicy food is another major trigger for acid reflux. The risk factors are things like smoking, which relaxes the sphincter, stress and anxiety, medication's a big one, especially if you're taking anti-inflammatory medications, so ibuprofen, naproxen, or antibiotics, they can also do it too. There is a condition called hiatus hernia, where your stomach protrudes through to your chest, so past your diaphragm, which is the muscle that holds your abdomen, stops it from coming through, and if you've got a hiatus hernia, you're also more likely to get acid reflux symptoms. When it comes to the treatment of acid reflux, it's so much easier to just give a tablet, and it may give people a temporary resolve in their symptoms, but it's not going to be the long-term solution. It's so much more difficult for people to identify their risk factors and then reduce that risk factor and work on it. I always like to focus on the lifestyle. That tends to be, for me, the majority cause of acid reflux. So if people are smoking, I'd recommend for them to stop or cut down. If they are overweight, I would recommend for them to start exercising, to start eating more healthily, to avoid some of the trigger foods we've talked about. Because unless you're doing those things, pasting on a tablet on top is not going to resolve the core issue. The core issue remains. When you come off that tablet, your symptoms are still going to come back. So it's so much more important to help people understand what their risk factors are and hopefully get them motivated to cut down and change those risk factors. A couple of practical tips at home which may be useful is firstly to wear looser clothing, no tight belts, those kind of things. Meditation may help if stress is a main factor for acid reflux, especially if there's tightness in the abdominal muscles. Meditation is going to relax you a little bit more. The other thing to say is lighter meals, so smaller meals, more frequent will be better. Also try and avoid having meals within 3 hours of going to bed, because posture is a big factor. If I'm lying down like this or I'm watching TV like this, for acid to go up the food pipe, fairly easy compared to when I'm up here. Gravity wise, it takes a lot more for that acid to go up, so the other posture is not so good. The same with going to sleep. General recommendation is just to put a few pillows so you're about 20-30 centimeters inclined, again reducing the chance that acid is going to work its way up against gravity. In the case of our friend Jack, it's important that Jack works on reducing his smoking, cutting down on his alcohol, because his alcohol drinking, even though 2 bottles of wine seems reasonable for most people, it's still above the recommended limit, and it will improve his symptoms once he cuts down on the alcohol. The other thing for him is he doesn't really do much exercise, so doing a bit more exercise will also help. If lifestyle factor changes haven't worked, then there are medications we can try for acid reflux. There are two main types. The first is antacid medications and the second is acid suppression medications. With antacid medications, they're alkaline-based tablets or liquids. They aim to reduce the acidity in the stomach and they can give immediate results. One of the examples of this in the UK is something like Gaviscon. When it comes to acid suppression, you've got two types of medications. The first is PPIs, not the one that telemarketers call you about in the middle of the night. The PPIs I'm talking about are proton pump inhibitors, and with the proton pump inhibitors you're essentially reducing the acid secretions, and hopefully with less acid secretions, less reflux. They are things like omeprazole, pantoprazole, lansoprazole, basically ending in zoles. The aim with this kind of treatment is to give the stomach and its surrounding area a bit of a break, and normally a 1 month treatment could be a good time to trial, and that gives the area some time to heal. The other branch are H2 blockers like ranitidine or nizatidine. At the moment in the UK there's a bit of a manufacturing issue with ranitidine, so it's slightly more difficult to get a hold of, but I found that they are a little bit safer to use long-term wise for acid reflux. Lastly, if all medications haven't helped, I normally send patients across for an endoscopy, which is a camera test to check for any kind of abnormalities in the stomach. I also tend to do a H. pylori Helicobacter pylori test, which is a bacteria that can live in the stomach, which can bring about some of these symptoms. All of that seems okay. Then the other option would be something like a surgery, although I have to say that's super rare to have surgery just for reflux. I think it's super important to go back and highlight a point that if you're having chest pain that is burning, it doesn't always mean it's acid reflux, because there are things that can cause chest pains like a heart attack, which can present very atypically, so very unusually. I remember a patient I had who was diabetic, and sometimes in diabetics heart attacks can be very atypical, and all they had was a stomach pain that was burning and that was going to their chest, and we ended up doing some investigation and they were actually in the middle of having a heart attack. So I would always say, if the pain is severe, if there are any worrying associated symptoms indicating a heart problem, then they need to be investigated by healthcare professionals in the correct setting. Sometimes, albeit rarely, these symptoms can be time critical and also life-threatening, so it's so important to get this checked out. That brings us to the end of the video. Thank you so much for watching, and I would appreciate some algorithm related button smashing, clicking, tapping, whatever is your fancy. And if you're new here, please consider hitting the subscribe and the bell. I make health videos. I try and summarize it and make them simple for you to understand. If you have any questions, leave them in the comments below. And this week's question is, what's been the most useful thing for your acid reflux? I've been Dr. Khalid. You've been bloody awesome. I'll see you on the next video.